Hello, welcome to Medicine Machines. Today we will look at burns. We will focus on types, causes and treatment for burns. We will start off by looking into first aid for first degree burns. So firstly, we should remove the affected region away from any possible dangers and turn off any electrical components. Next, we should remove any loose items such as jewellery and watches around the affected region. However, we must not remove any items on the site. Next, hold the affected region under a cold stream of water for at least 10 minutes in order to reduce the risk of swelling and pain. Next, we apply cling film for protection. The cling film retains moisture which reduces scarring. We will not apply cling film to severe burns. Sunburns, we will remove the affected region away from light, apply sun lotion to the affected region and observe. If it does not improve, further intervention may be required. So talking about the types of burns, firstly we have first degree burns, which involve the epidermis, which is the uppermost layer, and its appearance is red without blisters. Its texture can be dry, it's usually painful and it heals fairly quickly. Also, intervention is rarely required if managed well. Second degree burns involves the epidermis and the dermis layer. Its appearance can be red with blisters. Blanching can also be present, which is an obstruction of blood flow to that area. It can be very painful with a prolonged healing time. Also, infections like cellulitis may occur, but scarring typically should not be present if managed well. Third degree burns penetrate past the dermis and the subcutaneous tissue. It appears white due to blanching and the blood flow being affected. It's usually painless due to nerve endings being damaged. Healing can take weeks to months, and scarring will be present as well as contractures, which is tightening of the skin. Excision may also be required, which is removal of skin. Finally, fourth degree burns, which is the most severe, which extend to the entire skin into the fat and muscle below. They appear black, dry and painless. They will require extensive surgery such as amputations and excisions. They can cause death and impairment. Now I will show you how the different layers of skins are penetrated by the various degrees of burns. So firstly, the first degree burns penetrate the epidermis layer. The second degree burns will penetrate the epidermis and most of the dermis layer. Finally, the third degree burns penetrate all layers up until the subcutaneous tissue and below. If the burn extends to the muscle, fat and bone below, we class it as a fourth degree burn. Moving on to the causes for burns, not all burns are thermal reactions. Burns can be caused by chemical, electrical and radiation. Chemicals include hydrochloric acid and sulfuric acid. For chemical burns, you may wash the site initially, but intervention will be required. Electrical burns are classified as high voltage injuries which are higher than 1000 volts. Damage for electrical burns may occur internally, so therefore intervention is almost always required. Radiation burns may be caused by UV light or ionizing radiation such as X-rays. Depending on the amount of radiation, hair loss may be seen, redness may be seen, or peeling and necrosis may be seen. Therefore, intervention may be required depending on severity. Moving on to long-term treatment, burns can be very painful, so therefore pain management may be necessary, such as ibuprofen or paracetamol. In severe cases, opioids such as morphine may be used. Also, for severe burns, antibiotics may be given intravenously. And depending on the severity, surgery will be required for skin grafts, which is a temporary skin substitute. Other surgeries may include amputations and severe excisions. Also, intravenous fluid can be administered to prevent shock. Finally, there is moderate evidence to say that honey aids first and second degree wounds. Thank you for paying attention and please subscribe and comment below.